So what we see a lot more of is a type of OCD called moral scrupulosity, where it's a fear of being a bad person. That one's very common. There's also fear of harm coming to you or your loved ones. There's fear of being the person that might harm others. And there's other types of OCD that are really focused on perfectionism. So you might imagine someone like symmetrically lining things up on a shelf. Where I see it actually show up are things like symmetry and perfection out in the real world. Like, for example, I'm going to write this email, but it has to be 3 lines. It can't be like a little bit on 4. It all has to all fit onto 3 lines. And actually meticulously making things in your life just right is what I'm calling it. So those are just a few of the many options.
Welcome to the ADHD Families Podcast. I'm your host, Sharon Collon, an award-winning credentialed ADHD coach and consultant and mama and wife to a very ADHD family. I am seriously obsessed with making life easier for people with ADHD and those that support them. My business, The Functional Family, provides life-changing support and strategies for ADHD. I particularly love anything that saves time, decreases conflict, and creates space for fun. Do you want a life with your beautiful family that is more functional, fun, and full of joy? Let's explore together the wonderful and sometimes wacky world of family life with ADHD in the mix. Welcome to another episode of the ADHD Families Podcast. I'm your host, Sharon Collon, a credentialed ADHD coach and parenting consultant. Oh my goodness, we have a great episode for you today. We're talking about OCD and ADHD and how they cross over. And I think this is one of those areas that parents get really stuck. We're not sure what to do. I've got in the most incredible specialist in this field who specializes in ADHD and OCD. It's Natalia Aiza, and she's a seasoned therapist, a parent trainer, a writer, and an entrepreneur. Her core mission is to facilitate awareness and healing for those with OCD. We cover so much ground in this episode, and I really think that you should listen to it whether you identify with anyone in your family having OCD or not, because I think she has a lot of wisdom to share. And I think there's so many misconceptions about OCD that it could be the missing piece of the puzzle for one of your family members. In this episode, we talk about what to do, what is the different types of OCD, what to do with the compulsions, what as parents, what actions we should take. We talk about school can't. It is an absolute cracker, and she has incredible strategies and wisdom to share with us. Let's get to it. Thank you, Natalia. I'm so excited for our chat today.
Me too. Thank you so much for having me, Sharon.
Oh, look, I've got so many questions. I'm really excited to talk to you and also to share your amazingness with our community here at the ADHD Families Podcast. But can you start off by telling our beautiful listeners a little bit about you and the work that you do?
Absolutely. So I started working as an ADHD therapist and coach here in the United States, and I eventually transitioned to being full-time focused on OCD because so many people in our neurodiverse community also experience OCD, and I wanted to be a practitioner that's at the forefront of doing ethical work that is supportive both of neurodiversity and of healing OCD.
And I know from my beautiful community, this is an area that trips a lot of parents up, right? What you use for ADHD and OCD is like what strategies you use get a little bit confusing. So I'm really going to delve into that today. But before we do, I'd love to hear a little bit about your journey.
Yeah, absolutely. So I have both. I have ADHD and I have OCD. And I kind of knew that there was something that was taking away my ability to focus and that I was using anxiety to cope with that something. For many, many years, I had absolutely no idea what it was. I had this like secret intrusive thought that I was actually not as smart as I was pretending to be, that I was not actually capable, that I was faking it. And the whole time I had very severe ADHD and went through, top tier schooling in the United States all the time, only coping with OCD. So, in other words, I developed all of these compulsions and anxiety strategies, which actually made the ADHD go underground almost, because I was in those moments, I was fully functional on the outside. On the inside, I was an anxious mess. And so for me, my ADHD and my OCD go hand in hand and are kind of at war with each other.
I hear that a lot. And, I would love to go into, what OCD is, because I think for the listener, what media focuses on is the cleaning, right? The obsessive cleaning or the counting on the door handles and all that sort of stuff like that. But can you tell us about the different types of OCD?
Absolutely. There's so many. The one that gets seen the most is cleaning and contamination. Yes, they exist, but they are actually like a minority of our cases. So what we see a lot more of is a type of OCD called moral scrupulosity, where it's a fear of being a bad person. That one's very common. There's also fear of harm coming to you or your loved ones. There's fear of being the person that might harm others. And there's other types of OCD that are really focused on perfectionism. So you might imagine someone like symmetrically lining things up on a shelf. Where I see it actually show up are things like symmetry and perfection out in the real world. Like, for example, I'm going to write this email, but it has to be 3 lines. It can't be like a little bit on 4. It all has to all fit onto 3 lines. And actually meticulously making things in your life just right is what I'm calling it. So those are just a few of the many options. And for some of us, we have intrusive thoughts, which are unwanted thoughts that randomly pop in and scare us. And for other people, we have a type of OCD that is purely obsessional, and does not actually have this like extra component of these random scary thoughts. So, it's kind of all over the place, but the main thing that ties it all together is the cycle. So an OCD cycle is there is some fear, and then we do something about that fear, something physical or something mental, and then we are temporarily soothed. After this temporary soothing, we actually eventually go back into the fear. And in some ways, we've reinforced the original fear because we gave it attention. We engaged with it. And so that's why OCD sort of fuels itself and tends to snowball over time.
Oh, and you can see how that would escalate when you've got ADHD in the picture as well.
Yes.
Now, I've got to disclose that we come from a very OCD prone household here. We definitely have it here. And I think one of the most confusing things is, people kind of label it as anxiety. Can you tell me how it differs from anxiety or where the distinction is?
Yeah, it's a great question. I sometimes use the two words interchangeably when I'm speaking, and I absolutely do not mean to, because OCD and the clinical definition of anxiety are distinct. So you can feel anxious, you can experience anxiety, you can experience worry and not have OCD. So in the case that you have anxiety, you're experiencing these troubling, ruminative thoughts, as long as you're not doing anything to self-soothe, and as long as the fears aren't highly specific, then it's probably generalized anxiety disorder. What distinguishes OCD is, like I said before, that cycle. So we have this fear, and we can't just sit in the distress. we have to do something about it. We have to fix it somehow. That's what makes something OCD, is sort of engaging in this repetitious relationship with your anxiety where you're constantly trying to create a solution for it.
Okay, you just said so much gold there. So can you tell us about some misconceptions about OCD? Because I know that we touched on the cleaning one, where that's what people are looking for. But what are some others that people have?
Oh, so many, so many. I feel like the ones that annoy me the most will be the ones I'll share with you. But one is the idea that OCD is a good thing. So it's like a brag, a humble brag online. Like, I'm so OCD. Look at how, well organized my closet is. OCD is maladaptive. Those of us who have it for the lifetime, and those of us who have it in its more severe form uh, experience a lot of distress and difficulty, and truly it can reduce the quality of our lives. So it's definitely not something to humble brag about. Another misconception about OCD is that it has to be physical. That's not actually true. So you can have an entire OCD cycle in your head and just look like you're, dazed and like looking off into the distance. Especially when you have ADHD, it can get confused with someone just being distracted. But really, inside our heads, there's an entire cycle happening.
That's it's so great to know as well. And I really think that whole, look at me, I've got OCD, that whole thing. Oh my gosh, it's just so, it's a lot, isn't it? It's a lot.
Yeah, it's quite irritating. But, it sort of is what it is. We all have to deal with, people label themselves like, I'm so ADD as well. They do that. So I always say, well, first of all, it's ADHD, and it's a clinical diagnosis, not something that you just like put a label you put on yourself.
So now thinking about ADHD and OCD and the overlap, can you tell us a little bit about that, what that looks like?
Yeah, I think the best way to explain that overlap is to just speak from my personal experience. This might align with yours, it might not, but it's really the clearest way I know how to explain it is to explain my brain. So I will use the example of this podcast. I am chronically late to events because of my ADHD. I have intense time blindness. Here it's 9 p.m. And my ADHD medicine has long worn off. And so my OCD wants me to set not one, but 3 alarms for this event. So when I am going to, prepare for speaking with you, I know now that I cannot do that compulsion of 3 alarms, but that's what my OCD wants. And that's how my OCD will be satisfied. So all day, I did not put 3 alarms. I just had the one. And I had to sit in this ick, this distress of, I think I'm going to miss it. I think I'm not going to be on time. And I had to simply trust that I was going to be able to have enough executive function to show up and do a reasonable job. But my OCD, meanwhile, is badgering me to do it the OCD way, which is to follow this system that my OCD says is fail-proof. Right. And the truth is that these 3s is actually something that my OCD has wanted me to do forever. So I remember in high school, I couldn't remember the material. I couldn't retain it. So my OCD devised the rule of 3s that I had to read every Shakespeare play 3 times. I had to rewrite every essay 3 times. And so in my head, there's something magical and essential about the number 3 that will help me execute these regular tasks that like I really want to be able to perform without problem.
Oh, that was such a great explanation. Why is it so common that OCD is getting missed or misdiagnosed?
Mm-hmm. Well, I mean, I'll be frank. Like I I was high functioning my entire life, and I went to Harvard. I got into Harvard Law, and from the outside you would be like, oh, she's just tightly wound, right? But on the inside, I had this ADHD OCD battle constantly going on. But really, it was such an internally pained disorder. So, other disorders, let's say bipolar, it can be more geared towards other people. It can involve more people. It can be a little bit more dramatic. OCD, our drama tends to be that we retreat. So like a very severe person with OCD has agoraphobia usually, which means they barely leave their house. OCD often makes us make ourselves smaller rather than kind of make ourselves into any sort of spectacle out there in the world. And so it gets missed. We simply look depressed or anxious or just uninterested, but really we're stuck in our houses doing compulsions, loading the dishwasher in threes and not feeling comfortable with being out in the world that has so many triggers.
And you did mention it before. You talked about intrusive thoughts, and I've noticed more and more social media popping up about that. Can you explain to people what that is?
Oh, goodness. So before I do, I have to correct something. On social media now, there's this trope of the intrusive thought one, like I got bangs or something like that. Intrusive thoughts are not impulsive thoughts. Intrusive thoughts aren't like, ooh, like what if I do this fun thing? A true intrusive thought is a highly negative thought. It's usually ego dystonic, which means that it doesn't agree with our sense of self. So I will have and had, it's been a while actually, but I used to have all the time, you're a murderer going on in my head. So I have not committed any murders, just putting that out there. But my OCD was really trying hard to convince me of that I was capable of harming someone on that level. And so, for example, if I was walking near the knives, my OCD might say, you're going to stab someone. When I was close to a window, my OCD said, you're going to throw your child out the window. I would have all of these kind of out of nowhere, seemingly thoughts that involved me causing harm to others. And before I knew what my diagnosis was, I honestly thought I was a terrible person. Like, who thinks these things? Those are intrusive thoughts. So it's out of a fear that something bad is going to happen. And usually it's out of a fear that we are bad.
That was such a great explanation. So now thinking about what OCD looks like in children, because listeners to this podcast are parents and they are possibly listening to this thinking, oh my gosh, I can hear some things coming through. And we know that a lot of our kids with ADHD have looping thought patterns, or, they talk about their brain, not being able to stop things. So what would be some things that we could look out for as parents when we're on the lookout for this, for OCD and ADHD?
Yeah, absolutely. So I'll give a few examples again, because that's how I learn and think. Something that to look out for is your child is highly dependent on you at nighttime, because nighttime is often when a lot of the OCD fears strike. So if your child, for example, needs you to do a certain routine, but exactly that routine. So good night, I love you, I'll see you in the morning. But you can't leave off the I'll see you in the morning, or else they're going to experience panic. That type of rigidity is a really big clue that perhaps your child might be developing or has developed some OCD features.
That's a really good explanation. So thinking about now OCD, how it impacts school and friendships and family routines. Can you let us know how it would impact those things?
So many ways. So with friendships, OCD often makes us anxiously attached. So we have intrusive worries that people are hanging out without us. That's something that we're missing, something about how our friend feels about us, for example. Another consistent difficulty with relationships in OCD is the fact that we tend to ask a lot of our loved ones. We tend to seek reassurance, accommodation. And in the OCD world, accommodations are actually something that causes a lot of reliance on our family members. It's not like in ADHD where accommodations help you be more independent. In OCD, accommodations actually make you more dependent on other people, which is obviously not like that healthy for you. Another effect of having OCD for children will be, difficulty with really expressing what their true worries are, because often they're kind of nonsensical. And we, as the kiddos say, I low-key know it. I'm worried about this thing that I know is unreasonable, but they can't seem to feel comfortable sharing it with others. So a lot of times kids who are teenagers and really know that they shouldn't be worried about their parents going out at this point in their lives, they're terrified of their parents leaving the home. They're terrified of being alone, and they're afraid of vomiting. These are things that teens and young people have difficulty like really being vulnerable with each other about, but they're very common in the OCD population.
So now thinking about treatments, and if you could explain what some evidence-based treatments are for children with ADHD and OCD.
Yeah. So with ADHD, I'm not going to go over it because I know that that is something that your podcast is offering every day, but only to say that if your child has both, then I really want to make sure that the OCD specialist understands ADHD as well. We really do want that dual understanding, because otherwise they're not really going to be able to meet you where you're at and be able to see how your child has to use some coping strategies in order to function with the ADHD. And we can't take that all away and say it's all, rigid and all ritualized and routine. So the treatment for OCD is something called exposure response prevention, RP. So this is the gold star standard. It's basically a behavioral system where you face your fears, but you do so gradually. So it doesn't sound like the most compassionate of therapeutic approaches, but long term it actually is, because it gets you out of the therapy room quite quickly. We can usually get it done in maybe 6 months, 4 to 6 months of actual focus on the OCD. And it's not like you have to have a lifetime of therapy. OCD is treatable in a very clinical way. You list out all of the things that you're afraid of, then you list all the things that you do because of the things you're afraid of, and you and your therapist together create a fear hierarchy where you basically decide how you're slowly going to start dropping those compulsions and facing those fears.
Thinking about therapies or approaches that can make OCD worse.
Oh,
Because I know this is tricky. What have you come across that can make it worse?
well, number one is talk therapy. And I get it. I used to be a talk therapist. It feels like you're doing the right thing. It feels like, well, why wouldn't I validate this person's feelings? Why wouldn't I explore their childhood? Blah, blah, blah. And it actually makes the OCD so much worse, because in that case, the therapist becomes the compulsion. And therapy becomes this container for all the worry and to get reassurance from another person that you're okay, that nothing bad is happening. And so talk therapy really, I cannot overstate it. You cannot talk your way out of OCD. And talk therapy, in its very premise that you can sort of discuss your OCD until it's better, is false. It just doesn't work like that.
It's really great to hear. And so thinking about now advice that you would give to parents whose child is a bit resistant to going through the exposure therapy.
Yeah, I mean, so first of all, just kind of, I speak as an OCD human with OCD kiddos. There will be resistance. This is not the warm, fuzzy therapy experience that everyone is looking for. So we often have to bribe and beg and push and require to get our kiddo into therapy, this type of therapy. That being said, I always tell parents, give me 5 sessions. By the 5th session, I've got their heart. I know that they know that this is working and they want to come back. But the first, few sessions are going to be touch and go because it's super unpleasant and they don't understand why they have to do it. So if you can't even get your kiddo into the room, then that's when I recommend Dr. Leibowitz's work. Is called the SPACE program, Supportive Parenting for Anxious Childhood Emotions. And it's actually an OCD therapy that is 100% coaching parents. This is something that I also do. In addition to doing therapy with children, I will work on the side coaching globally in order to help parents get their kids to the therapy room and notice what they are doing that is actually exacerbating the OCD cycle, because we often are. Even I go home and sometimes reassure my child when, instead of making them face their fear, it's a completely natural thing for parents to do, to try to be the person in their child's life that soothes and not the person that challenges. But unfortunately, we do have to learn how to get our kids into that challenge zone so that they can grow and also defeat their fears.
This is the moment that trips parents up, right? So we get that when we have ADHD, we kind of coach them through things, and we it's almost like being their safe person is the most important part, right?
Mhm.
But then if where parents struggle is when we're pushing them through that fear. That's where we get tripped up. Can you tell us how you support parents through that? Because that's the bit that I'm just not sure about.
Oh,
Yeah.
it is tricky. And I always tell parents, I do my best parenting in this therapy room. When I go home, I will make the same errors because naturally, as parents, we want to be nurturing, we want to be compassionate. And in the moment, being strong with the OCD doesn't feel compassionate. In the moment, it feels like, well, why wouldn't I rescue my little person from distress? Like, I get it. What I, as a therapist, can see that parents often can't see is that there's a long game here. Hey, we need to prepare our children for success in the world, success without us, and resilience. And yes, if we refuse to engage with the OCD or accommodate the OCD that night when they're 11, yes, it'll be hard that night. It might be hard, that week. But long term, it will make your child stronger because they do need to learn how to handle distress. And I think that's the big thing that modern parents are afraid to teach. And so, helping your child go into a room that is dark rather than letting them, turn on all the lights and sleep that way is, it feels really harsh. It feels really hard. And also after a night or two, they're going to be like, oh, I don't need to sleep with all of the lights on. I'm actually okay. And those are the lessons that actually mean more to them than, the soothing that you're offering that night.
It's the long game. Okay. So thinking about that distress and reinforcing compulsions and things like that, how can parents help manage that distress? Trying to get their child into the dark room. How does that play out for parents? What should they be doing?
So I say, do less. think as parents, we're trying to do all the things now. And ironically, sort of our generation, when we were children and had OCD symptoms, we didn't actually get accommodated or coached through it that much. And it actually helped us rely on ourselves for soothing. That being said, I would often start with something more gentle, like I see that you're scared, or I'm here if you need me. Something generic and warm, or just being present. So I do therapy where we are really like facing something dark for the client. We're doing something like writing their obituary, for example. There might be moments where we have to pause and just like be human and acknowledge the fact that this is heavy stuff, and that's okay. You saying to your child, like, I see that you're trying really hard and I know it's not easy. That's healthy, that's kind, just not too much of that. Because if you're pushing your soothing too hard, then you're communicating to the child that you think that they can't handle it. We want to communicate to them that it's no big deal, and we really do believe that they can deal with it, frankly.
So it's showing a quiet confidence in them.
Yes.
So tell me what you wish more people understood about OCD.
So many things. One of which is that OCD, and I'll focus on kiddos now.
What do you wish more people understood about OCD?
I really hope that people start to understand how it's different from anxiety. I get so many clients that come into my center having been misdiagnosed with anxiety for 10, 15 years. It's heartbreaking because when we have the anxiety diagnosis, we don't know that we need specialized treatment with ERP. So I think that just understanding the cyclical nature of OCD and the types of phobias that are common with OCD would completely change people's experience. It would get everybody or most people diagnosed so much quicker. That's what I truly wish for.
Now, I couldn't do this podcast without asking about school can't, right? We know that ADHD, school can't, a lot of kids are having trouble accessing school. But what I'm wondering is whether when we have OCD in the picture, whether diagnosed or not, whether this is what is underneath it, and what your experience has been with school can't.
Can you just define school count for me?
So a school can't is kids not being able to access school, so not being able to get them to school.
Got it. So in the United States, we call that school refusal, which is not a better term. I like school can't, but I've never heard it before. I just did a presentation with the ADA here in the United States on school refusal. It is an incredibly pervasive issue. And I think that in the communities of neurodiversity, we first have to acknowledge that school is not designed for us. It just isn't. Hard stop. So we have to have a far more compassionate and open-minded view of school refusal or school can't when we are talking about our population. However, with OCD, what ends up happening is that being afraid of school starts to be the obsession in OCD, right? And so then the compulsion, the C in OCD, is to stay home from school. It's to not go into a situation where you're going to be triggered. And so it's the kind of thing that ends up snowballing over time. So at first it's one day, one mental health day here, one mental health day there, one like undefined tummy ache. And suddenly there's so much school getting missed, and there's such a reward for missing school that we actually end up with children who prefer home to school, which is not natural for children. They are programmed to want to be around their peers, but so many of our kiddos now are wanting to be behind screens and in their homes. and in relative anxiety safety. So the key is to believe that your child can. So every child is a school can on some level. You want to exude that quiet confidence in the morning that they will make the choice to go to school, and be incredibly supportive of the true difficulty that they're facing in school, while not supporting school avoidance, because that is going to make it worse.
The next question I wanted to ask you is about time or stages of life. So I know that for me, my OCD came after each pregnancy, so after I gave birth, essentially. And I feel like for a lot of parents listening to this, they might not realize that OCD comes in like waves. Like once you have it, you don't always have it. Like you can have stages or where it flares up. Can you tell us a little bit about that so we can help, let people know that it's not like a one and done kind of thing?
Absolutely. So what's interesting is at my center, we see so many children, but we have most of our child clients are at 7, that age for some reason, and then puberty. Those are the big onset times, right? So OCD correlates with the hormones, the growth hormones. And for born females, there is a strong correlation both with life cycles and also menstrual cycles. So OCD very much ebbs and flows, just like hormones do. And I think that one of the key issues that we don't quite understand is how it relates to the endocrine system. However, you will notice that your child will have seasons of OCD. Another way that it ebbs and flows is actually with infections and allergies. So with kiddos that have strong allergic reactions and their immune system is overreactive, they might have some inflammation, and you might see some OCD symptoms come up. Same thing, there's an issue called PANS PANDAS, which is basically an inflammatory response in the brain to an infection in the body. And that's another time when you see a rapid onset of OCD symptoms. So there's a tremendous mind-body connection when it comes to OCD, and it's also genetic. So you have a genetic predisposition to it, and it's important to look in the family tree who maybe has hoarding disorder, which is genetically related, who might have Tourette's. All of these sort of subgenres, specific phobias, all of these are connected in this OCD constellation.
Thank you, because that's so helpful. So thinking about, if you don't mind, if I'd love to ask you about your personal experience. When you were talking about coming on this podcast today and you were with the 3 reminders, what I would love to know is how you coach yourself to only do the one, because doing the compulsion feels like the right thing to do, right? So how did you do the one?
So at this point, it's a muscle. Right? We have incredible neuroplasticity as humans, and we can recondition ourselves. So 3 doesn't even feel like that great of a number to me anymore, which is amazing because it went from being like this number that I had on a pedestal to feeling just like another number. My special relationship to 3 got interrupted by doing things in different numbers so many times that my brain's sort of connection to that particular ritual got severed. Nonetheless, I'll still feel the temptation. I'll still feel that urge coming up, but it is just so much less strong than it used to be. Had this been 10 years ago, I would have spent the entire day in low-grade panic if I hadn't done those 3. And now I might have like an intrusive thought every once in a while. Did I put an alarm? It was just 1. Maybe I should check it. Am I sure it's okay? But none of them actually hook. Like I'll have these intrusive thoughts, or I'll have just these OCD thoughts, and I don't really pay them much mind. They come in, they flow out, and I just kind of carry on with my day. But that's from years of practicing turning away from the OCD and to do something that actually is a cognitive restructuring act, which is to do the opposite of what your OCD wants you to do.
So do you think that the ADHD, obviously the executive function, like the impulse control, that power of the pause, which is so much of what we do in ADHD coaching, like trying to teach people to do that and support people to have that pause before they action, is that where it kind of can really come unstuck for people with ADHD as well? Like before they know it, they're doing the compulsion without pausing.
Oh, yeah. Yes, 1000%. When we're going through this life without having strong impulse control, we are going to do our compulsions. We're going to do all sorts of behaviors, and we're not going to be able to regulate ourselves until we get that slowing down that happens, that we can coach in ourselves, that medicine can help some of us with, that meditation, just being able to allow yourself some time for decision, because ADHD, oh my gosh, our brains just want to barrel forward into whatever will get us that dopamine hit. And in the case of OCD, it's often doing the compulsion that gets it done.
You can see how it would trip people up, right? Like,
wow.
But you know what I've found from this discussion today is just overwhelmingly how hopeful it is and positive it is. Like you've got a roadmap out of, what you're saying, OCD makes your life small. You've got a roadmap out of it,
yes.
Right? Make your life whatever size you want it. Doesn't have to be dictated by OCD, which I think is fabulous.
Absolutely. It's so treatable. I couldn't do any other type of therapy, honestly. Like I need to do something that's as treatable as OCD, because I love that satisfaction of getting someone unstuck. So just as long as people trust the process, they get an exposure response prevention therapist, someone that really gets it. It is like 80 or 90% effective rate. It just has to be the right time and a person that really understands OCD. Those are the two critical components. And by right time, I mean, you want to get better, because Natalia 20 years ago was completely happy being stuck in her stuff. She was not in a place where like there was openness to change. It just wasn't my right time. But when it was, it came together quickly.
So tell me, how can people find you?
Oh, well, my Instagram handle is at letstalk.ocd. And honestly, drop me an email, natalia@kairoswellnesscollective.com. I still compulsively answer those. I am really into responding, because if nothing else, there's just one person that hears you and guides you to somebody in your area, in your neck of the woods. Or if you're looking for OCD or parental coaching, I can do that from wherever. So feel free to drop me a line and tell me what you're looking for and what you're wondering about.
And I'm going to put a link to all of Natalia's details in the show notes as well. But I want to say thank you so much for sharing so much wisdom with us today. Oh, I just love it. Love it.
Thank you. It was really nice being on, and I appreciate so much when people are specializing in ADHD bring me to speak about OCD. Nothing makes me happier, because it can really help our quality of life. And I wish that when I was learning about my ADHD, I also knew more about this other side, the OCD control that I was actually finding to be a bigger stranglehold on my life than anything else.
I'm hyper aware that a lot of parents listening to this might just be the missing link, that they, that this could be lining things up for them. Thank you so much for being here and sharing your wisdom with us.
Thank you. Take care.
Thank you for listening to this episode of the ADHD Families Podcast.
If you loved it, please share it on your socials. I want this to start a conversation about ADHD. If you want to make this mum do a little happy dance, please leave a review on iTunes. If you would like to know more about what we do, check out thefunctionalfamily.com. I truly hope that you enjoyed this podcast and you use it to create a wonderful, effective, joyful life with your beautiful children.